What are bad signs after tick bite? I'm Dr. Daniel Cameron. This is a part of a Common Sense Lyme series. Many people remove a tick, move on, don't think about it, but I wanted to discuss the things you should look for after that tick bite. Now, when you get a bite, it isn't always a typical bite. Sometimes it's a mark. Sometimes you see the tick and scratch it off, not even sure what it is. But a lot of times people never see the actual tick that bits them. They leave a little rash. But it's still important to at least be aware of what to look for. The symptoms can be vague. They can be anything from headaches, extreme fatigue, night sweats. Even night sweats could be from a co-infection. Some develop an erythema migrans rash. The best rash, called the bullseye rash, makes the best picture, but it's actually not the most common rash. Much more common is a flat red rash, but when the rash is atypical, scaly, deep purple, or some other kind of rash, or occurs at the same time as poison ivy, it can be very difficult to know if it's an erythema migrans rash. Also, the CDC accepts an erythema migrans rash that's at least 2 inches in diameter, at least, but not every rash quite makes at 2 inches, so I like to keep any lookout for a rash that occurs after a tick bite. Some develop early signs, like Lyme arthritis. Everyone looks for a swollen knee, which is how they first discovered Lyme, but a lot of people have an arthritic pattern, knees, hips, back, various parts of the body that's migratory, that doesn't get swollen. There's also Bell's palsy, Lyme carditis, which is a block of the electrical current in the heart, which lead to a low heart rate. And early disseminated infection is still pretty early on. Sometimes they have multiple rashes to look for. It can even look like meningitis. Some people never develop early signs of Lyme disease. They go right to late stage Lyme disease. In this case, I always am on the lookout for unexplained fatigue, brain fog, peripheral neuropathy, which includes numbness and tingling, mood changes, unexplained moods or exacerbated moods, or difficulty with various psychiatric drugs that they don't no longer work, sleep disturbances that resemble sleep apnea, and also autonomic dysfunction like POTS, lightheadedness, heat intolerance. So what if you don't remember tick? People actually don't remember tick very often. In one study, only 1 out of 5 of the participants had a tick that they could remember. Bites can be painless and they can go off unnoticed. So what do you do after a tick bite? You should look for rashes, lingering flu-like symptoms. Pay attention to various symptoms like fatigue, brain fog, and chest discomfort that occur within weeks of a tick bite, and get checked if something feels off. In summary, tick bites often go away on their own, but not always. Early diagnosis improves outcomes, so be on the lookout for other presentations than an erythema migrans rash. Also look for late manifestations that could occur not that long after the tick bite. Check yourself, your ticks, your pets, and don't dismiss symptoms that don't go away. Any questions, you should be consulting your healthcare professional. And thank you for joining me for this Common Sense Lyme series.